Welcome to Mighty Mornings. I'm Mary.
And I'm Lindsay. Let's dive in.
Welcome to Mighty Mornings. Today we're going to talk with Dr. Eric all about sleep and how it can benefit our health. We're so lucky to have this conversation with him. Welcome, Dr. Eric.
So welcome back, Mighty Family, to another Dr. Eric Debunks. I read a quote the other day that I found to be quite relevant to today's segment. And that quote is, "A good laugh and a long sleep are the best cures in a doctor's book." So today I really want to dive into sleep and its relation to aging. As medical professionals, I found that this is really an area we don't emphasize enough, yet it has such a huge impact on your overall health. So to begin, we first have to address, why is sleep important and what does it do for our body? So one of the most important functions of sleep is its role in learning and memory consolidation. So sleep deprivation has been shown to lead to worsening memory and overall decline in brain function. I remember back in the day when I would have to work 28-hour shifts, and I remember by the 24-hour mark, my working memory was practically non-existent. I could have a conversation with a nurse, and moments later, I could barely recall what the conversation was about. So if you're noticing your brain has been foggy lately, or your memory has not been as sharp, it may be time to reassess your quality of sleep. Another important function of sleep is its impact on your immune system, heart health, and metabolism. It is well known that during sleep, our bodies are healing and growing. But what I found particularly interesting though, is that during sleep, that is when the waste products in our brain gets cleared. And some of these waste products are known to contribute to Alzheimer's disease, which is a form of dementia. As for heart health, sleep deprivation results in increases in blood pressure and worsening cardiovascular health. In fact, even just one bad night of sleep can already lead to increases in your heart rate by 5 beats and blood pressure by 10 millimeters of mercury. So can you imagine how much your heart is suffering if you're chronically sleep deprived? Aside from physical health, sleep plays a massive role in mental health as well. There's a strong association between sleep deprivation and depression and anxiety. I mean, that's no surprise. When we wake up unrested, the day is already off to a bad start. Maintaining good health simply can't be done without consistent good sleep. We should be giving ourselves the best chance of having a great day every day, and that truly starts with a good night's rest. I know everyone has different responsibilities and different lifestyles, and sometimes getting a good night's rest is not an option. What I really want to push the Mighty Family to do is to really prioritize sleep, because it's evident how much it can impact our day-to-day health and our future health. The next question I get asked a lot is, why do we sleep less as we get older? Do we actually need less sleep? So what we do know to be true as we age is that there is in fact a change in our circadian rhythm, which is our internal clock that controls our sleeping schedule. With age, there tends to be a decrease in total sleep time, sleep quality, and an increase in the time it takes to fall asleep. What is interesting is that studies show that if you maintain good health, this trend of worsening sleep tends to plateau around age 60. However, if you have multiple chronic conditions, age-related sleep changes may continue to be exacerbated. So then, what causes sleep changes as we get older? There are 2 main hormones that are important in regulating our sleep-wake cycle. As we age, these hormones in our bodies change, thus leading to changes in our sleep. Cortisol is a hormone produced by the adrenal glands in response to stress. It is also involved in regulating our body's metabolism, immune function, and blood pressure. One of the ways that cortisol can affect sleep is by disrupting the body's natural circadian rhythm. Cortisol levels are typically highest in the morning and gradually decrease throughout the day, reaching their lowest point at night. As we age, the levels of cortisol in our bodies can decrease, and such decrease can affect our normal sleeping pattern. Melatonin is another hormone that is involved in regulating our sleep-wake cycle. It is produced by the pineal gland in our brain in response to darkness and helps to promote sleepiness and prepare our body for sleep. As we age, the levels of melatonin in our body can decrease, leading to changes in our sleep patterns and an increased risk of insomnia. This can also lead to changes in our circadian rhythms, making it more difficult to maintain a regular sleep-wake schedule. So with these changes, it is important to recognize that the body still needs adequate sleep. The golden rule of 7 to 9 hours still holds true. However, what may be different with your now changing internal clock is that you may find yourself well rested with 6 hours. So the takeaway here is that you don't need less sleep, but your body may be adjusted and okay with less. And I do recognize that getting a good night's sleep is a luxury that not everyone has. And I want to take a moment to clarify what insomnia is and how we can recognize if we have it. So by definition, insomnia is a predominant symptom of difficulty with sleep initiation, difficulty maintaining sleep, or early morning waking with inability to return to sleep, causing clinically significant distress or impairment in activities, occurring at least 3 nights per week for 3 months or more. Okay, and it is estimated that 6 to 10% of adults meet this diagnostic criteria for insomnia. So with that said, how do we treat insomnia? As a primary care doctor, I have so many patients endorse difficulty sleeping and request medications for it. And I'm always hesitant because oftentimes these sleeping medications are never good for you and simply sedate you. So instead, I try to empower my patients to do a few different holistic things before jumping into medications. First thing I recommend is maintaining good sleep hygiene. So good sleep hygiene refers to a set of practices and habits that can help maintain or promote healthy sleep. So here are some good tips for sleep hygiene. So 1, stick to a consistent sleep schedule. Go to bed and wake up at the same time every day, even on the weekends. And 2, create a comfortable sleep environment. Keep your bedroom cool, quiet, and dark. Invest in a comfortable mattress, pillows, and bedding. 3, avoid stimulating activities before bedtime. Avoid using electronic devices, watching TV, or engaging in any activities that are mentally or emotionally stimulating for at least 30 minutes before bedtime. 4, limit caffeine and alcohol intake. Avoid caffeine and alcohol close to bedtime as they can interfere with your sleep. 5, regular exercise can help improve your sleep, but avoid exercising close to bedtime as it can be stimulating. 6, engage in relaxation techniques such as deep breathing, meditation, or progressive muscle relaxation to help calm your mind and prepare your body for sleep. 7, avoid eating large, heavy meals before bedtime as this can interfere with your sleep. And lastly, 8, limit naps. If you need to take a nap, keep it short, 20 to 30 minutes, and avoid napping too close to bedtime. The second thing I recommend is stimulus control. The goal of stimulus control is to associate the bed and bedroom with sleep so that the body naturally prepares for sleep when you enter the bedroom and get into bed. Stimulus control works by eliminating the association between the bed and activities that are not related to sleep, such as watching TV, reading, or using electronic devices. By doing this, the bed becomes a cue for sleep, which can help to improve sleep onset and quality. So here are some strategies used in stimulus control. 1, use the bed only for sleep. Avoid watching TV, reading, using your phone or laptop, or doing any other activities. 2, go to bed only when you feel sleepy. If you're not sleepy, try engaging in relaxing activities such as reading a book, listening to calming music, or taking a warm bath. And 3, get out of bed if you can't sleep. If you're unable to fall asleep after about 20 minutes, get out of bed and do something relaxing in another room until you feel sleepy again. So by implementing these strategies, you can help to establish a strong association between the bed and sleep, which can improve the quality and duration of your sleep over time. The third thing I recommend, if the prior two still doesn't work, is cognitive behavior therapy, specifically for insomnia. So mental health plays such a big role in being able to get a good sleep. As you can imagine, anxiety, depression, PTSD can be huge barriers for getting a good night's rest. Cognitive behavior therapy is a form of psychotherapy done by a professional therapist that is evidence-based and helps to restructure and identify negative thoughts and beliefs about sleep that may be contributing to insomnia. So in fact, it is the golden standard for treatment of insomnia. All right, I feel like I have to at least touch on sleeping medications, as I know our mighty family is curious. If I have to prescribe a sleeping aid, my first go-to medication would be melatonin. The reason being is that it is a natural hormone our body produces, and it is generally safe. You can purchase it over the counter. There are a few side effects worth mentioning, such as dizziness, headaches, nausea, and even mood changes. However, these are quite rare, as I feel most people tolerate it quite well. In regards to supplements that help with sleep, there are a lot of teas out there that can be helpful, such as chamomile tea, lavender tea, passion flower tea, just to name a few. However, with all supplements, always good to check with your doctor first, as sometimes they can cause interactions with the medications you may be taking. Okay, mighty family, that was a lot of information. So let me try to summarize it for us in a few mighty takeaways. So 1, sleep is essential for maintaining good health, and we know that sleep disruption among the aging population is strongly associated with poorer cognitive performance and an increased risk of cognitive decline. So prioritize your sleep. 2, our bodies change with age, and so does our internal clock. Even though we may feel well rested with less sleep, it doesn't mean we need less. So those 7 to 9 hours are still golden. 3, insomnia is common among adults. But recognize that sleeping medications are often not good for your health, and there are plenty of other methods to achieve a good night's rest, such as cognitive behavioral therapy, stimulus control, and good sleep hygiene. All right, mighty family, this wraps up our segment for today. As always, I look forward to connecting with you all again soon. For those that are not a part of the Mighty family just yet, check us out at mightyhealth.com for more. We're striving every day to be the modern, holistic home for healthy living.